what did you find in the adult population?
Well, I did a single site study, which means I was the only site that got to do it. And I had 26 patients in the study. They were ages 18 to 55. And we did rating scales to see where their ADHD symptoms were. And they had to have at least a 24. It was interesting because in the kids study, about 60% were male. And in my adult study, 73% were female. But that's the biggest group that's coming in and looking for treatment right now. So their baseline rating scale score was about a 33. Remember, they had to have a 24 to get in. We had 5 patients discontinue during dose optimization, but only 1 did because of side effects. And when we dose optimized everybody, we did it over several weeks. The highest dose allowed was actually 50 milligrams in the adult study, 37.5 in the kids study. And at 30 minutes after dosing, we looked at effect size based on how well they were doing on MAD tests. And at 30 minutes after dosing, the effect size for CTX 1301 was 1.41. Well, effect size gives you a way of comparing different drugs without directly comparing them head to head. And an effect size of 0.8, 0.9 is large, 0.5 is moderate, and lower than that, a 0.2, 0.3, that's a really low effect size. Stimulants, if you can get 0.8, 0.9, that's great. Ours at 30 minutes, 35% of the medication had been released, was 1.41.